Welcome back to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about the neurosciences. We're learning about the nervous system and the brain. We heard from Dr. Ben Brown in our first segment about brain care and about trauma. We'll hear next from Dr. Seth Hayes, a colleague in the Ochsner Neurosciences Institute at St. Tammany Health System. Dr. Hayes, welcome to the program.
Thank you.
Really excited to have you here. Maybe start first with a little bit about your background.
Sure. So I'm a neurosurgeon. I went to medical school at LSU in New Orleans, and then trained in neurosurgery for my residency at the University of Miami, where I also did a complex and minimally invasive spine fellowship.
Ooh.
Then my first practice was in North Carolina at Duke, and then we relocated back home, and been practicing here for going on about the last 5 years or so.
Outstanding.
So we've been part of kind of this build with St. Tammany and the community over the years.
Well, and I think that's one of the things that's really special about the partnership between Ochsner and St. Tammany. I think neurosciences is probably my favorite example of the partnership, because you have St. Tammany Parish Hospital, which is the flagship of St. Tammany Health System, and that is the hospital where so many people who live in West St. Tammany count on that system for their care.
Right.
And then you bring the partner Ochsner Health into the picture, and they have tertiary and quaternary care. That means highly specialized care that they're able to bring into this market, and the Ochsner Neurosciences Institute is a really good example of that.
Yeah, absolutely. And I think it's great. Locally, we have our practice, and there is a high level of care that I think we've brought here with an extensive partnership, that goes beyond us and is multidisciplinary throughout St. Tammany in the health system. And at the same time, we have a lot of resources. So we have partners throughout the state, that we really are able to rely on to have, large multidisciplinary conferences that we can really bounce off consultations and, use a lot of outside knowledge and experience to be able to bring that home and keep care local.
Right, and keeping care local is the whole purpose of the partnership.
Correct.
I think you mentioned that some of your advanced training when you were away from here was in minimally invasive spine surgery.
Correct.
And so maybe tell us a little bit about what that means and what you're able to do in Covington because of the technology that's here.
Yeah, so I think, from the standpoint of minimally invasive techniques and some of the technology, we've really done a great job with the partnership, and St. Tammany has put a lot of effort into acquiring the technology we need. So, for example, we have small access ports and corridors that we can use to minimize incisions and what I call collateral damage, minimizing soft tissue injury to get where we need through small ports, smaller incisions, which really leads to a lower risk of infection, need for serious things that people worry about, like blood products. And many of these technologies and techniques just lead to a quicker recovery with less general stress on the body. Wow. So some of the technology we've used, we have intraoperative CT scans and, sort of like Dr. Brown has mentioned, GPS-like systems, where we can see inside the body without looking through the tissue. And so screens that allow us to use this, we've required robotics and brought kind of robotic brain and spine surgery, which has a lot of advantages and encompasses all these multifactorial techniques and technologies that we can utilize to achieve goals with patients, to minimize stress, to minimize hospital stays, and it's in my opinion very impactful.
Wow. So between the expertise that you and your partners bring and the technology and the specialized support staff that the hospital has, you have this capability there in Covington at St. Tammany that maybe in the past people might have felt they needed to travel out of town for that level of care.
Yeah, I think so, and I think it's been great. We all travel and spend a decade and years learning how to perform these techniques, but the commitment really, and I think the sometimes undervalued piece of the puzzle is the team that we put together. So from the operating room to the clinic, to the nurses that care for patients at every aspect, from recovery to the inpatient facilities and needs, we've done a lot of effort to create a team that is specialized in caring for our particular patients, with brain and spine care and some of these minimally invasive techniques. And that really goes a long way, I think, for effective care, quality care, and really patient satisfaction. People are a lot happier when you're doing the same thing and you have such a skilled and qualified group of people doing it.
That's fantastic. And I think in the case of spine care, in the first segment we were talking more about brain, and so we were thinking about things like trauma and stroke, and not that the spine wouldn't be involved. Certainly trauma can have a lot to do with that. But I think a lot of spine care comes from chronic pain and maybe injuries or accidents that can happen to people, or things that occur over time like aging and arthritis. So can you talk a little bit about what types of patients come in and sometimes need your help?
Sure. So certainly the minority of patients on the hospital side, we deal with serious issues like cancer, infections, and more serious traumas like immediate automobile accidents that can lead to spinal column fractures and injuries. And that's one component of the job. The other component, a lot that we see in clinic on the outpatient side, is, like you mentioned, the evaluation of the never-ending arthritis. So you can have pain, right, which is very common with neck and back pain, similar to a knee. However, when you start dealing with the spinal column, there are what I call red flags, or pain plus. And that's a lot of what we do, is we screen and evaluate treatment plans, and we rule out some of the more concerning problems. And that can be simple problems, neck and back pain. Oftentimes we're able to manage with therapy or anti-inflammatories, or refer for injections and other simple strategies. And then we rule out some of the more serious forms of arthritis where we have slipped bones, or because of the overgrown joints and disc herniations and ligaments, it can encroach the canal where your spinal cord or some of your nerves live. And that's where we start talking about, pain plus. Are you having new numbness? Are you losing function in your hands and dropping mugs? Trouble with buttoning, losing balance and walking, foot dragging on the ground. So some of these problems can occur just with basic degenerative arthritis. And that's a lot of what we evaluate. Hey, this is safe. This requires imaging. Here's a problem we need to talk about. Some of it, and much of it, is still not managed with surgery, but we're able to safely educate and manage in another way. But certainly a big component of our job is to rule out these more dangerous or serious components of that. And that's where a lot of these strategies of surgical discussions, value, and a lot of the breakdown of that is kind of the summary.
Well, I think that's really maybe part of the value of having an organization as complex and as evolved as Ochsner Neurosciences Institute, to have at St. Tammany Health System a part of this group that has that capability to look at how serious is this, and do we need to be going down a path of spine surgery, and what kind of options do we have for this patient who is experiencing this maybe debilitating pain or degenerative disease in their bones or their spinal cord. And I'm envisioning the advantage being the multidisciplinary group that you're talking about. These are folks who bring different areas of expertise of neurosciences together. So you're talking to folks who work as surgeons full-time, focused on surgery, and you have folks who their areas of specialty are more in rehabilitation or in other methods and choices. And so together you can look at a case and decide, this really needs to pursue a surgery, this really doesn't need to pursue a surgery.
Oh, absolutely. And our collaboration goes very deep with primary care physicians, a lot of different care in the community. We run into a lot of unrecognized kind of spinal pathology, osteoporosis and bone mineral density issues, vitamin D levels, and these are things that a lot of the primary care teams work with us, and then more specialized bone mineral density clinics and endocrinologists, and then the collaboration between interventional pain management and physical therapy and rehab medicine, neurology. It goes very deep, and I think the advantage with a lot of these is that we're a team. We have open lines of communication. We try to work very well together, and I think we have some really high quality people that are in place, that are compassionate and make decisions that are best for the patient with the patient, based on their goals. And
Dr. Hayes, I really appreciate you coming in. This has been so educational for all of us.
well, thank you for having us. We appreciate it, and thank you for your time.
You bet. You're watching Healthy Living, brought to you by St. Tammany Health System. We're talking today about the neurosciences, and we'll be right back.